The global issue topic I will be talking about is migration. Today, migration is a very popular topic. People immigrate from one country to another for a variety of reasons. Some are forced to move due to conflict or to escape from death, while others may voluntarily immigrate. Although such a move may be necessary, it can be quite traumatic on top of all the challenges experienced so far. According to the United Nations of Economic and Social Affairs, the world counted 258 million international immigrants in 2017, representing 3.4% of global population, and that number is just increasing. There is an urgent need to engage with migration at all levels in order to support progress towards global health and develop goals to successfully help them. All healthcare should emphasize the importance of creating an enabling environment for migration at national, regional, and global levels. Immigrants move for better opportunities, some agricultural workers, and international students. Immigrants are considered a vulnerable population and might have a greater than average risk of developing health problems. Vulnerability often exists among certain populations because of discrete social cultural status, which is correlated with limited access to economic resources. Public health access exists, and immigrants go to it when it's only needed and sometimes it's too late. I know today there are low income based clinics who have doctors and nurses staffed to help the vulnerable population. As one of our vulnerable population clinical sites last semester, some of you might have experienced caring for immigrants. Some have a hard time communicating due to language barriers, but the facility might have an interpreter provided. Yet, those immigrants still trust the nurse with the care they're providing. Communication and trust are also critical in building a relationship with immigrants so they can continue to seek care there. The health issues presented can include chronic conditions, like diabetes is very common, mental health, substance abuse, reproductive health, infectious diseases, and environmental health. According to the American Nurse Association, in 2010, ANA House of Delegates held the position that health care is a basic human right, and that stated that all individuals who reside in the U.S. should have access to health care, including documented and undocumented immigrants. The resolution is rooted in nursing's professional ethics to advocate for the care for individual families, communities, and populations. The resolution reflects ANA's responsibility as a professional organization to speak for nurses collectively in shaping healthcare within the U.S. and address health policies that affect accessibility, quality, cost, and the violation of human rights. Other issues arising due to immigrants are introducing disease outbreaks. However, the CDC is a world leader in health promotion and disease prevention and works with immigrant, refugee, and migrant groups to improve their health by providing guidelines for disease screening and treatment in the United States and overseas, tracking and reporting disease in these populations, responding to disease outbreaks in the U.S. and overseas, advising U.S. partners and healthcare for the health refugee groups, and educating and communicating with immigrant and refugee groups and partners. Immigrants all around should prioritize their health. Therefore, all countries should address immigrants with no discriminations and offer public health services that encourage to seek help or involve in screening and prevention programs. Even though other countries do not have public health access available, there are other interventions that can provide, like education and healthy eating. Immigration is growing and it is inevitable. Therefore, all healthcare professionals should also be culturally trained to take care of this population.